Every year in this country, 300,000 women are diagnosed with breast cancer, and the majority of them will have early stage disease and will opt for breast conserving surgery to remove that cancer, plus a rim of normal tissue all the way around. The objective of the surgery is to make sure that there's no cancer touching the edge of the specimen. For patients who have positive margins where the cancer does touch that edge, we often need to go back, take a little bit more tissue to make sure that there's no more cancer there. Well, no patient likes to go back to the operating room, surgeons don't like to go back to the operating room, and the healthcare system suffers as a result. So we asked the question, how can we do this better? Some surgeons had argued, maybe if we just took a little bit more tissue all the way around the cavity at the time of the first operation, we could obviate the need for a second. Other surgeons argued, that really doesn't make much sense. Why couldn't we just x-ray the specimen, see where we might be close, take a little bit more tissue there? For years, this has been a debate in the breast surgery literature. But now we have the first randomized control trial that answers that question. So the SHAVE trial told surgeons to do the operation that they would normally do. Do your very best. X-ray the specimen, grossly analyze it, take a little bit more if you thought you needed to. And then, once you were happy and you were ready to close, stop. There was a randomization envelope that was opened intraoperatively in the operating room, and surgeons were either instructed to close as they normally would, or take a little bit more tissue all the way around the cavity. The groups were evenly matched, and we saw who did better in terms of positive margin rates and re-excisions. With a very simple technique that takes only about 10 minutes in the operating room, we were able to cut in half the re-excision rate, cut in half the positive margin rate. And we did so without any decrement in the patient's perception of their cosmetic outcome, nor any increase in complication rates.